Go ahead, ma'am.
Good evening, all. Myself, Dr. Kanchan Durukar. I am consultant at OSS Fertility Vakad Pune. Today, we are here for our another Facebook Live session. Uh, and today, we are going to discuss about how to improve the egg number in the patients or in a female, how to improve the egg number. So, we are going to discuss in a short, in a nutshell, 5 points about how to improve the egg number in a patient. So basically, when a woman conceives a female child, so she has a particular number of eggs, or we can say follicles. So these are in the very primordial stage, in very primary stage these follicles are. So these follicles are maximum when the female fetus, that the lady has conceived a female fetus. So in at her intrauterine age of 20 weeks, the egg number is maximum. Now when she gives a birth, when a lady gives to a female child, gives birth to a female child, that time particular fixed number of eggs are there in the ovary of that female child. Now these are in millions actually. Then when the girl reaches puberty, then these are in the number of thousands, that is 20 to 40,000. Now as the reproductive age goes, like every month there is a period. So as this every month period is there is ovulation, and along with ovulation, that is single egg is released, but along with that particular number of eggs also go atresia. Now what happens to the egg count or egg number with the age? Why we are worried about this egg number or age? So dear friends, the egg number is very much age dependent, or fertility as such is very much age dependent in case of females. Like in males, the fertility or sperm production or sperm number is sperm count, we will say, is not that much age dependent as we say it in the females. So in females, the fertility starts declining from the age of 30. So the sperm count doesn't decline if the in the males who have reached even till the age of 40. But the females who have reached age of 40, in these patients the egg count is generally depleted. So why this happens, why this egg count is depleting in the females? So because the particular number of eggs are present, the limited number of eggs are present in the ovaries, and as the female ages, so the egg count goes on depleting. So this is the rule of nature, I can say, that as there is a aging of the female, the egg count starts depleting, and by the age of 30, it goes on decreasing, and by the age of 40, the egg number is very much depleted. So we should plan the pregnancy, or any female should plan her pregnancy before the age of 30. And also those who are planning to delay their pregnancy, they should get their AMH test done, and also fertility checkup done to know their egg reserve, so that they know their egg number. So how can we improve this egg number? So basically there we can say that there are no many as such medicines to increase the egg number. So egg number is limited, as I said, and it goes on depleting, so number cannot be improved. But yes, the egg quality can be improved by using DHEA. Then a DHEA is a male hormone which can be given for the periods of 2 to 3 months, which can improve the egg quality to some extent. Also CoQ, that is coenzyme Q. This is a mitochondrial energizing agent which can be used for the females, and it can cause improve in the egg quality. It is just like an antioxidant. CoQ is an antioxidant which has to be given in the proper dosing, and if at all it is given in proper dose, then it can improve the egg quality. but again it is an empirical treatment, I will say. Then also now some recent advances are coming, which are claiming that they can restore they are called as ovarian rejuvenation techniques. These are the recent technique which are coming up for improving the egg number, or we can say ovarian rejuvenation. So what are these ovarian rejuvenation techniques? So these are like ovarian PRP, that is platelet rich plasma, is injected into the ovarian stroma. And this platelet rich plasma is the patient in how it is extracted. So patient's blood is taken first, and then it is centrifuged, and we separate the blood from, and we separate platelet rich plasma. Now this platelet rich plasma is injected in the ovary, and after injecting this platelet rich plasma in the ovary, we have seen ovarian rejuvenation, and we have seen some successful results in the patients with ovarian PRP. But still it is a experimental therapy, I will say, not yet fully proven therapy that it improves the egg number. Then ovarian stem cell is also one of the therapy. It is again ovarian rejuvenation therapy, where we take the stem cells. These are taken from the bone marrow of the patient. The stem cells are the pluripotent cells. Pluripotent in the sense they can transform into any form of cells. Pluripotent, that means they can go into any direction or any cell line they can follow, and they can then behave likewise. So these stem cells are injected into the ovary, and these can cause the ovarian rejuvenation, and these can further improve the egg number. But again it is a experimental therapy. Ovarian stem cells, these all procedure, ovarian PRP and ovarian stem cell, these are done under anesthesia. These procedures are done under anesthesia, and again these are the experimental procedures. Then follicular activation is also procedure, one of the procedure. This is again a recent advances. Very few cases are reported all over world about this ovarian activation. So what is this follicular activation? This is, in this what we do is we remove some of the tissue from the ovarian cortex. So it is done laparoscopically basically. So in this what is done, that some of the tissue from the ovary is removed laparoscopically, and the fragmentation of this tissue, ovarian tissue, is done, and again it is placed in the ovary, and hemostasis is confirmed. So this follicular activation, OTA, it is called ovarian tissue activation. So this OTA is again one of the experimental technique which has been shown to improve, AMH and follicles or egg number. Again, experimental therapy. Very few, papers are there on this therapy. So after the end of this techniques, I would say that basically there is no as such a foolproof method which can improve the egg number of in a lady. If the lady is coming to me and saying that, madam, I want a technique which can improve my AMH, or which can improve the egg number of mine, so I will say that there is no actually method which can actually improve the egg number or AMH follicles that are present. So, what can we do to not land up in the situation where we are in the low egg count? So, basically, we can do is some modifications, that is early childbearing. If at all it is not possible, that early childbearing is not possible, then at least oocyte cryopreservation. Oocyte cryopreservation is you freeze your eggs, okay, you freeze your fertility. So with the recent advances and the recent cryopreservation technique, it is possible that you can freeze your egg, you can plan your pregnancy later. So these are the this is method which has come up, and which is showing the promise for the patients who want to delay their pregnancy, but still they are worried about their fertility preservation. So oocyte cryopreservation or egg freezing is one of the method. Otherwise, if you are married and still you want to delay your pregnancy, after 35 you want, after like nearing 40 you want your pregnancy, then embryo cryopreservation, that is we retrieve your eggs, we do the ICSI, we make your embryos, and we freeze them in our lab. so that embryos will be frozen with us, and whenever you want to have a pregnancy, then we can transfer those embryos. So this is the embryo cryopreservation. So these two methods are there, where we can think about the delaying the pregnancy, and still we can have a fertility preservation, fertility preserved. So these are things. Other minor things which we can do in our day to day life is, having healthy food, having the food which has natural antioxidants like fresh foods, fruits, green vegetables, avoiding canned food, junk food. These all has oxidative stress, so this can, and avoiding stressful life, having proper sleep. So this all, meditation, this all stress free life can increase our antioxidants in our body. Exercise can increase endorphins. This can again have some antioxidative effect. So these are the healthy lifestyle measure which we can implement in our life. And of course, avoiding any addiction, like smoking is very deleterious for your eggs. So avoiding smoking, alcohol, and also even not the active smoking but also passive smoking should also be avoided. Passive smoking in the sense that other person is smoking and you are getting exposed to that smoking, so that is also deleterious for your health. So active smoking, passive smoking, any other form of addiction, any other form of tobacco or any addiction should be avoided. That is not good for your egg number, also egg quality also, that needs to be checked. And other things are that I told about: lifestyle modification, weight control. So these are the minor things that you can do at your part, to preserve your egg number, egg quality. And of course the recent advances also I talked about. So in the nutshell, or to summarize this today's talk, I would say that the limited number of eggs are there in the female body, and you should get your fertility checked. So it is there is no harm in getting checked your AMH and your egg number. So this can tell you better, or you can plan better, that yes, is I have a time to plan a pregnancy after 2 years, or if at all, how is the AMH accordingly, should we plan a pregnancy early. So this can tell us that how to manage, or how to plan a pregnancy. So AMH is a very important thing which can help us in planning the pregnancy. And if at all you want to delay pregnancy also, recent advances are available with us. I talked about oocyte cryopreservation also, embryo cryopreservation also. If at all you are married, then embryo cryopreservation. If you are not married, then oocyte cryopreservation. These are the techniques which can help you freezing your fertility. Then other techniques I told about is the, if at all you have already poor or a reserve, then techniques, the tablets form are available, like DHEA, CoQ. These are the antioxidants and DHEA hormone. Also, surgical methods are there, like ovarian PRP, ovarian stem cells, then ovarian tissue activation, that is OTA. These are the experimental, therapies that are available for ovarian rejuvenation, we call them as. But these are again the newer studies, experimental strategies. These are so. These can be tried for the patient who don't want donor eggs, they want it with self eggs. But yes, of course, this we should be aware that these are the experimental therapy, and we need to go ahead, and still we want to go ahead with these. So these are the techniques for ovarian rejuvenation. Lifestyle modification I also talked about. So these are the small things that we need to know about, and we should be aware of. So in the take home message from this video, I will say that you should get your fertility checkup done. At least get your AMH done. It is a simple blood test that you can do and get your fertility checkup done, and it can further guide you regarding how you can wait, or you need to hurry up to have your pregnancy, or maybe any if you are not married, then maybe fertility preservation for that matter. So dear friends, you should it is not that you should be anxious whether I am fertile or I am losing my fertility. I don't say that you should be anxious, but yes, you should be aware also that these are the methods, and yes, I should be well planned. So these are the things you can do, and yes, you can be well aware of your fertility and get it checked. uh, I think this is all from my side. If at all any questions from here, I'll be happy to take them. And if at all any consultations are required, helpline number are there on the screen. And for physical consultation, you can visit us at OSS Fertility Vakar, Pune, or OSS Fertility Kharadi, Pune. Thank you all. Thank you for your patient listening. Does PCOS affect egg quality? So yes, definitely, but not all the patients, I will say. But egg quality is different from egg number. So today we didn't talk about egg quality basically, but yes, because of PCOS, there can be hormonal imbalance, and because of hyperandrogenism that is there, the egg quality can be affected. What is the best AMH for pregnancy? So we say that the AMH between 2 to 4 is the best AMH. Below that it is a low AMH, or and above 4 it is called as a PCOS. So the AMH between 1.5 to 4, it is the best AMH, or we can say it is a better AMH. How can I increase the egg number? So our Facebook live today was on this topic only. So to improve the egg number, as such, there is no foolproof treatment to increase the egg number from the given point of time. But yes, there are some medicines like DHEA, CoQ, which can improve the egg quality. And some newer techniques are coming up, like ovarian PRP, ovarian stem cells, and OTA, that is ovarian tissue activation, which claims that they can improve the egg number. I think it is done from question answer side also. So thank you all the viewers, and thank you for your patient listening. Thank you so much.